Garcia here, one of the joint restoration surgeons at Orthopedic Specialists of Seattle. Today is a good testimonial. This is a patient that came in, had seen a number of doctors, really medial-sided pain, and actually both knees were just as bad. And it turns out that after looking at some x-rays and stuff, that the rest of her knee was good. Her kneecap was pretty good. The outside of her knee was pretty good. So it's kind of a challenging situation because a partial knee won't do that well, but she's still young at 55 and wants to be very active with limited restrictions. So then you start thinking about joint restoration and mainly osteotomies. Now, osteotomies, when the knees are bowed like this, is something usually a high tibial osteotomy. So we talked about that. You can't do it at the same time. It's not really a great idea, so you have to stage it. So we staged her and she did incredibly well. I mean, she's 4 months out from the other side, much farther out from the other knee. You can see that she's able to go back to her high level activities. She's healing really well and she's very happy. So enjoy and you'll learn a little bit about this. Thanks.
My name is Maria and I am 55 years old and I have been doing Taekwondo for over 10 years now. And as I've gotten older, the arthritis started kicking into my knees and it made it more and more difficult for me to do a sport that I loved. I was wearing braces and taking pain medication and doing all the things I could do to avoid the knee pain, but none of it was working. So I went to different orthopedic surgeons looking for a solution, getting injections and all those other things. And it came down to a point where they were telling me to get a knee replacement. I didn't want to do that. I was told that things were more restrictive after a point. So I ended up finding Dr. Garcia, and he gave me the option of a high tibial osteotomy to kind of straighten out that leg and open up the space between my knees, and it has worked fantastic for me. So both knees were the problem. After a really high impact sport with lots of twisting and turning, both of them were gone. And I've had surgeries fixing meniscus and doing ACL repair, but it was down to bone on bone. And so about a year ago, I had my left knee a high tibial osteotomy, and then this past March I got my right knee done. I really loved working with Dr. Grant. He gave me options that I hadn't been given before. Again, high tibial osteotomy versus a full knee replacement. So that gave me an option to keep my knees, which was very important to me. And he explained everything. He gave me the possible outcomes that could happen with it, and I feel like he really walked me through every step. My recovery has been amazing. After the first knee surgery, I went and did a hike through Banff and didn't feel a thing in the knee that was repaired. And after my second surgery on my right knee this past March, I've been able to go back to Taekwondo. I've been able to kick, do some jumping, do some running, and it feels really good to not have to be completely medicated and braced up just to do the things I like to do. If I'm not at Taekwondo, I'm spending 8 to 10 hours in my yard doing the gardening that I love to do, so I feel back to pre-knee injury.
Are you happy you did these?
Oh, absolutely. I would do it all over again. It was amazing to be able to sit here and feel like I could keep up with the activities that I wanted to keep up.